Hi guys, welcome to my channel. Before we get started, make sure to hit that like button and also subscribe to my channel. Understanding and managing heart health and cardiovascular disease. So make sure to watch the full video. Prevention methods for heart disease. Despite being a major cause of death, heart disease is preventable. There are several strategies to lower your risk of heart disease, even while some risk factors such as age, sex, and family history cannot be changed. Start by implementing these first 7 suggestions for improving heart health. 1. Abstain from cigarettes and smoking. Quitting smoking or using smokeless tobacco is one of the healthiest things you can do for your heart. Make sure to stay away from secondhand smoke, even if you don't smoke. Tobacco contains chemicals that can harm the heart and blood vessels. Smoking cigarettes decreases the amount of oxygen in the blood, which causes the heart to work harder to pump enough oxygen to the body and brain, raising blood pressure and heart rate. But there is good news. As soon as one day after quitting, the risk of heart disease begins to decline. The risk of heart disease is almost half that of a smoker after a year of quitting. No matter how much or how long you smoked, you'll start to benefit as soon as you stop. 2. Start walking. Aim for 30 to 60 minutes of activity per day. Heart disease risk can be lowered by engaging in regular, everyday physical activity. Your weight can be managed with exercise. Additionally, it lowers the likelihood of getting other diseases like type 2 diabetes, high blood pressure, and conditions that can strain the heart. Although you might need to gradually work your way up to these objectives if you haven't been active recently, in general you should aim for at least 150 minutes per week of brisk walking or other moderate aerobic activity. 75 minutes of brisk aerobic exercise, like running, every week, at least 2 strength training sessions per week. Don't lose up if you can't fulfill those recommendations. Even brief bursts of activity are good for the heart. Simply moving for 5 minutes can make a difference, and actions like gardening, housework, using the stairs, and dog walking all contribute to your total. Although you don't need to work out hard to reap the benefits, you can increase the size of those benefits by working out harder, longer, and more frequently. 3. Maintain a heart-healthy diet. A balanced diet can lower the risk of type 2 diabetes, lower blood pressure, and enhance cholesterol. A heart-healthy dietary regimen consists of fruits and vegetables, additional legumes such as beans, fish and lean meats, dairy products without or with little fat, grainy foods, nutritious fats like olive oil, dietary approaches to stop hypertension, DSH, and the Mediterranean diet are 2 instances of heart-healthy eating regimens. Reduce your consumption of the following: salt, sugar, complex carbohydrates, alcohol-saturated fat, which is present in red meat and full-fat dairy products, as well as trans fat, which is present in fried fast food, chips, and baked goods. 4. Keep a healthy weight. Heart disease risk is increased by being overweight, particularly in the center of the body. Conditions like high blood pressure, high cholesterol, and type 2 diabetes can be brought on by being overweight and raise the risk of getting heart disease. To assess whether a person is overweight or obese, the Body Mass Index, BMI, uses their height and weight. A BMI of 25 or greater is regarded as overweight and is typically linked to higher blood pressure, cholesterol, and an elevated risk of heart disease and stroke. Measurement of belly fat can also be done using the waist circumference. Having a waist measurement bigger than increases your risk of developing heart disease. Males must be 40 inches, 101.6 centimeters tall. 88.9 centimeters, 35 inches, for females. A modest weight decrease can be advantageous. Even a small weight loss of 3% to 5% can help reduce the levels of some blood fats, triglycerides, blood sugar, glucose, and the risk of type 2 diabetes. Even further weight loss aids in lowering cholesterol and blood pressure. 5. Sleep soundly each night. Obesity, high blood pressure, heart attacks, diabetes, and depression are all more common in those who don't get enough sleep. The majority of adults require at least 7 hours of sleep per night. You should prioritize getting enough sleep. By going to bed and waking up at the same times every day, you can establish a sleep schedule and stick to it. To make it simpler to fall asleep, keep your bedroom dark and quiet. Ask your healthcare provider if you should be checked for obstructive sleep apnea, a condition that can raise your risk of heart disease if you feel like you've been getting enough sleep but are still feeling fatigue all day. Loud snoring, brief breathing pauses throughout sleep, and gasping for air when you awaken are all symptoms of obstructive sleep apnea. If you're overweight, obstructive sleep apnea treatments may involve decreasing weight or using a CPAP machine, which maintains your airway open while you sleep. 6. Control stress. A few people choose unhealthy coping mechanisms for stress, such as binge eating, drinking excessively, or smoking. Your health can be improved by finding alternate stress reduction techniques, such as exercise, meditation, or relaxation techniques. 7. Attend routine medical exams. The heart and blood arteries can be harmed by high cholesterol and high blood pressure. You probably won't be able to tell if you have these illnesses without getting tested. You can learn your numbers via routine screening and determine whether you need to take action. High blood pressure. Childhood is typically when routine blood pressure checks first begin. Blood pressure should be checked at least twice every 2 years, beginning at age 18 to check for high blood pressure, a risk factor for heart disease and stroke. You'll most likely get a yearly screening if you're between the ages of 18 and 39 and have high blood pressure risk factors. Every year, blood pressure is also checked on people 40 and older. Amounts of cholesterol. At least once every 4 to 6 years, adults should have their cholesterol checked. Although testing for cholesterol typically begins at age 20, earlier testing may be advised if you have additional risk factors, such as a family history of early-onset heart disease. Screening for type 2 diabetes. Heart disease and diabetes are both risk factors. Your doctor may suggest early screening if you have diabetes risk factors, such as being overweight or having a family history of the disease. If not, it is advised to start screening at age 45 and repeat the test every 3 years. Your doctor may prescribe drugs and suggest lifestyle modifications if you have diabetes, high blood pressure, or high cholesterol. As well as adhering to a healthy lifestyle plan, make sure to take your medications as directed by your doctor. Cardiovascular disease, what is it? Heart and blood vessel illnesses are collectively referred to as cardiovascular diseases. These conditions may impact a single or multiple areas of your heart and/or blood vessels. A person may have symptoms, physical manifestations of the disease, or be asymptomatic, complete lack of symptoms. Heart or blood vessel conditions that are categorized as cardiovascular disease include narrowing of the blood veins in your body's various organs, including your heart. Birth defects affect the heart and blood vessels. Heart valves that aren't functioning properly. Abnormal cardiac beats. How widespread is heart disease? The top cause of death, both globally and in the United States, is cardiovascular disease. In the United States, cardiovascular disease affects over half of all individuals. It has an impact on people of all ages, sexes, races, and socioeconomic statuses. Cardiovascular disease kills 1 in 3 women and people who are born as females. What signs or symptoms are there of cardiovascular disease? Depending on the reason, the symptoms of cardiovascular disease can change. More subtle symptoms may occur in older adults than those who were born with the gender assigned. Nevertheless, they are still susceptible to severe cardiovascular disease. So that's it for today. We hope you enjoyed the video. Use the comments section below to tell us your thoughts about the video. Also, make sure to subscribe to our channel and click the bell button to be notified of all the latest videos.